I'm Brandon Roberts here with Carol Napier. And Carol, we have coming up the 4th annual remote area medical clinic at Pike Central. And if you don't mind, go into a little bit about how we got involved with this and then how it's evolved in Pike County once it...
Okay. Actually, it was Judge Rutherford before he took office in January of '07. He was up in Wise, Virginia, and he saw signs indicating there's a free clinic. So he thought he'd explore that, and then he came upon the clinic that it was a remote area medical clinic, and he knew when he took office in January that would be something he'd be interested in bringing to Pike County, and that's how it came about.
What seems to be the most utilized service at the clinic?
The most utilized services are dental, with our vision being the second biggest component, and then of course the third being the medical.
And I was notified by Bob Finch that there's going to be more optical options this year.
Yeah, this year we're real excited about the optical component, in that we're going to have 2 optical schools that's going to be participating this year, as well as 2 mobile units that RAM headquarters will be bringing to make the glasses. So we're real excited about that. We have several local optometrists as well as optometrists from across the state that will be at the clinic working as well.
What type of dental services are available to those who've fallen through the cracks in regard to medical services?
Okay, would be if the person needs extractions, cleanings, fillings, or if the individual has dentures perhaps and they need repair or reline, they can bring those with them. But those will be the services that will be provided in the dental.
Well, how many people are you expecting this year?
Well, last year we saw 930, so we anticipate that we'll see well over 1,000 this year, and there's no doubt. Primarily because of the medical, the optical schools that are involved this year been participating. So we anticipate there'll be well over 1,000.
And talk a little bit about the U.S. Public Health Service's involvement in the
This will be
clinic.
The second year that United States Public Health Services will be participating. They use this as an opportunity to train their forces in disaster. So we're real excited to have them back with us. We'll be having 80 of their members to volunteer with us those 2 days.
Okay, and what this program actually won a National Association of Counties Achievement Award. Where do you see RAM going in the next 2, 3, 5 years?
Well, I see eventually probably us expanding it to maybe perhaps having a 3-day clinic. As now, as you know, it's a 2-day clinic. The other, Wise, Virginia has a 3-day. So, I see that as, on down the line for us, because we've really grown. Just this been our 4th year. So I see, later maybe having a 3-day clinic.
What is the oh, hang on a second, I lost it. I had some. Oh, yeah. In regard to size, where does the Pike County RAM rank as far as services rendered to people?
I would say they were, within the, I'm going to say within the top 10% anyway. The biggest clinic they have, of course, is in Wise, Virginia. It takes place in July. Of course, now California did have a 3-day or maybe a week-long clinic. But primarily, most of the clinics offered by RAM are 2-day clinics. But given the number of people that come out and participate in our clinics, I would think that it was rated pretty high.
Of course, volunteers are very important, or they're of the utmost importance for this event. What's the volunteer register looking like this year?
Okay, right now we have well over 600 people that are volunteering, and that includes the 80 from the U.S. Public Health Services.
And that's local.
That's local as well as across, local doctors as well as across the state. Some from either out of the state with dentists, that were able to get a charitable license through Kentucky to participate. So we have several that's coming from other areas of the state that's be helping in the dental clinic.
Or if someone's interested in volunteering, that they contact you?
Well, at this time, we're not accepting any more volunteers because we have reached the number that's needed for this clinic. But we do welcome them to contact us about next year's clinic. We're always looking for volunteers for, to register early for that, because we're having several that has been with us since day one when we had the first clinic in '08 that have, as a result of their first, so they were so impressed with it, they decided to come back and volunteer and have every year since.
And don't let me leave anyone out here. Is it the event sponsored by Kentucky Ram?
The Kentucky Ram is the organization that the Pike County chapter falls within.
All right, the Pike County government?
The Pike County Fiscal Court is the host.
And the University of Louisville School of Dentistry?
Yeah, the University of Louisville School of Dentistry has been with us since day one. In fact, if it wasn't for them, we wouldn't probably be able to have the clinic, because being that the dental is our biggest component, we had to find a dentist or our dental school that was willing to participate. And of course, U of L signed on from day one and been with us since that time, and led to the success of our dental clinic.
Also, several medical screenings are available, such as cholesterol, diabetes, cardiovascular disease, as well as female specific, such as breast exams and whatnot. Have you seen any growth in that participation in those?
Yeah, we did see an increase in the number of individuals that received treatment last year in our medical component. So I do see that growing every year. So we provide the basic screenings, as you mentioned, screenings for cholesterol, diabetes, et cetera. And then we'll have also individuals there that will be providing information, education type information regarding cancers. So like I said, every year that component's grown as well. But our two major is the dental and the vision. That I've found over the years, that's where most of the people come for us to get treated in the dental and vision.
And this is June 11th and 12th?
Yeah, June 11th and 12th. The clinic opens at 6 a.m. It'll be on first come, first served basis. I might want to tell the viewing audience sort of how, what takes place when they come. Since it is on a first come, first served basis, we have individuals that actually come on Friday evening. And when you come up to Pike Central, there'll be someone there at the gate who'll give you a number, and they'll direct you to the parking area, which we refer to as the holding area. And we'll have a shuttle bus that will be providing transportation down to the school. What happens is when Stan Brock, who's the founder of RAM, will go up, he'll call off the numbers in order, and then of course they'll be brought down by the shuttle bus, and then they'll go through patient registration where they'll sign in, then they'll let the individual know what services they're there for, and then they'll be directed to whichever component they're there for. The date will be June the 11th and 12th. As I said, the clinic doors opens at 6 a.m. If for those individuals that may have questions as to what types of services will be offered, they can call my office. The number is 432-6246, and we'll be happy to answer any questions they may have.
What is it? Do they stay open until everyone gets seen, or is there a shut-off time?
Usually the clinic, the doors open at 6, and usually they start calling off numbers probably around about 2 or around 3. And the reason being is because they'll have several that's already waiting to be seen. And then on Sunday, they usually, I think the last one they take in is probably around noon, because the students have to get back, to Louisville. And then, as I mentioned earlier, we have the 2 optical schools that's coming out of Ohio State University and out of Memphis Southern that will have to be leaving as well. So usually it winds down around about 1 on Sunday.
I'm Brandon Roberts, here with Dr. Randy Litman, Associate Dean for Clinical Sciences at the Pikeville College School of Osteopathic Medicine. And Doctor, how did you get involved with RAM?
Well, first of all, I have to thank Judge Rutherford for inviting Pikeville College School of Osteopathic Medicine to be involved. Upon his invitation, we became actively involved. Former Governor Paul Patton, our college president, said, A-OK, I'm all for it. Our dean, Dean Boyd Booser, looked at me as the clinical dean and said, you're the fellow to start it. So that's how we got started.
And what's your major role in the actual event?
I'm the person that's going to look at the 5 major causes of disease in our state, which is obesity, high blood pressure, sugar, heart disease, and lung disease.
When you say sugar, you're referring to diabetes?
Yes, I am. I'm referring to diabetes. Those are the major killers in our state, and it's our job at the RAM event to screen all of our patients that come in for any one of those 5 diseases, give health care information, direct them, and get them follow-up care.
Is it a voluntary screening, or do you do it to everyone?
Everybody that comes in will have blood pressure checked. We have nursing schools from all over our state that have volunteered to do vital signs checks, which is the pulse, the blood pressure, the times of breathing called respirations. Anyone that comes to our booths, we have family doctors from Louisville that are coming in. We have internal medicine doctors from Louisville that are coming in. We have myself here in Pikeville. I have 18 Pikeville College School of Osteopathic Medicine students that'll be assisting at the exam tables. I have 8 students from the University of Louisville that are brought in by my counterpart, Dr. Faye Jones, who is the clinical dean at University of Louisville. She is bringing 8 students from her school to assist me in doing this work with the group. She's also going to be conducting pediatric physicals for these individuals that come in.
Have you seen an increase or a decline in those 5 areas over the course of the event, the clinic?
We have seen greater follow-up. The health department, under the direction of Paul Hopkins, he has gotten the follow-ups from the prior years. They've carried them to getting treatment for especially cholesterol, elevated cholesterol, which is one of the major causes of heart disease, and for the sugar problem that we have here. The event has also allowed us to look at women's health and men's health issues like prostate disease, like cancers of the breast, cancers of the uterus. We have people from the United States Public Health Service that are going to be conducting women's physicals that are going to allow us to screen for that. Paul Hopkins takes that information and he gets them follow-up here in the community, gets them into the system for doing regular feminine screens. They do follow-up men's health as well. We will get PSAs done. Highlands Regional Medical Center this year is going to be doing all of our blood work as they've done in the past years, and they will do the men's health PSA. They will be doing cholesterol. They will be doing sugar for us, which will give us an idea of the risk factors for heart disease. All this information goes to the health department. The RAM people help us to organize, and Carol Napier in Judge Rutherford's office organizes names, addresses, places, such that we can get follow-up for these people and get them aftercare.
Where do you see the RAM, this particular one, in 5 years?
I see this stretching to other parts of our state that are also medically underserved. When I say medically underserved, we have people that come in not just from Pike County, but the neighboring counties that are in search of primary care physicians to have the opportunity to be screened, be treated. Our dental care, for example, these people are coming from places where we have one dentist taking care of hundreds of families. They're overworked, and they come in, and the dentists that come from University of Louisville primarily are working now to aid in treatment of dental disease, which contributes to heart disease.
The optical options this year have been increased. You want to talk a little bit about that?
We have a larger elderly population than we've ever had before. We have populations with diabetes-related eye disease, high blood pressure-related eye disease, individuals, the older population that feels segregated from society because they plain can't see, and they do not have the ability to get an exam and to get glasses which will give them the ability to communicate. So under the direction of Dr. Regina Compton, we're bringing in individuals from other optometric schools into the region to conduct an NMOS screening for diabetic eye disease, hypertensive eye disease, glaucoma, as well as refractory needs.
I'm Brandon Roberts here with Dr. Greg Bentley, president of RAM Kentucky. And Dr. Bentley, the dental services offered at RAM are every year, if I'm correct, the largest used service.
Yes, with the dental, it's usually the largest component with basically all the RAM exhibitions that are done. That's just a service that a lot of people kind of put off until the last minute unless it's a dire emergency. So that's usually something that people are really highly seeking service of.
Well, and of those services, the extractions, the fillings, and whatnot, what do you see the most being?
This area, it varies. Mostly extractions, more restorations than some of the other places that have volunteered at. But with this area, it's usually extractions, and that just goes to where people have put it off to the point that they can't put it off anymore. Risk of infections and the pain. So that's probably the biggest reason.
How did you get involved with RAM originally?
Well, when it first came into Pike County, which you probably know that how the judge, Rutherford, was interested in spearheaded the effort to get RAM in Kentucky, and he recruited Dr. Bill Collins to help coordinate the effort. Well, Bill and I have been friends through undergrad at Pikeville College and classmates at the University of Louisville School of Dentistry. So we've known each other for quite a long time and been really good friends. And so he had called me and was needing some help. So thought I would just help him as a friend. But the thing is, once you do one, you're hooked. You see what this means to people. So I did it first out of a favor for a friend, but I continue on out of the reward I see that I get and the help that I can give to other people that need the services.
And now you're president of RAM Kentucky.
Yeah, yeah. It seems like it just goes on and on, but yeah, it's great.
Well, everyone else with whom I've spoken has said that they expect this year's to be the largest. They expect over 1,100 people.
That's what we're shooting for. Every year has grown. More and more people are seeing that we're there, that we've been there year after year. This is like our fourth event. So we are rooted in this area, and that has a factor, but also I believe, you know, unless you live under a rock, you know the way the economy is, and that's more for a reason for people to put this off. So we're becoming more of a vital service, unfortunately. I mean, this is not what we want the healthcare in the United States to be. This is just a Band-Aid for the situation that we're in right now.
So you do feel like that maybe some people that come to RAM, that's their yearly doctor or dental visit?
Unfortunately, it probably is, you know, and that's the sad situation, but that's just the facts that we have to live with right now. So we do the best we can with what limited resources that we have available to us.
I'm Brandon Roberts here with Paul Maizan, a fourth-year dental student at the University of Louisville and also a member of the University of Louisville RAM chapter. Talk a little bit about your involvement in RAM and how you feel it's benefited you.
Well, after the first year, we heard about RAM through the University of Louisville, And we went to it, and we didn't know what to expect. And we were amazed at how many people showed up, all the different healthcare providers. And we actually got to experience something that I will continue to do even after dental school. After that, we really were taken under the wing of Dr. Greg Bentley and Dr. Bill Collins, and pretty much showed us how RAM works. And ever since, we've been going to different RAMs in different states, and we even started the first chapter at our University of Louisville School of Dentistry RAM chapter, and we're trying to get that to spread to other schools.
Do you feel that the RAM in Kentucky is similar to the other ones you've been to, or is there a different kind of need?
The one in Pikeville is probably the largest. It's the most well-run. It's established. The others are smaller, but the need is still out there. There's such a need, and it's so fulfilling when you see somebody that just says thank you for taking me out of pain. So it's.
You mentioned this is something you'll continue doing even after you're out of school. How do you feel like it's advanced you as a dentist?
Incredible. I mean, it's Dr. Bentley and Dr. Collins have taken us under their wing, and we're able to. They show us their techniques on how to do certain procedures, and at school, you know, you are in a school environment and you learn the procedures. The application of it is when you come to these events, these clinics, and I feel confident in procedures that I do. I recommend it to anybody at our school. We've had 120, I believe, last year went from our school alone, and the experience you get is wonderful, but it also helps. It's service isn't defined as an active, helpful activity, and it's providing that for somebody, and it's what RAM really is all about. And hopefully it'll be able to go to different states. I know there's laws that prevent certain practitioners come in to actually practice, but it's not going to solve all of our healthcare problems, but it definitely helps. And there's such a need out there. And if we can do more, I'd do them every other weekend. I really would. It's just a fulfilling event.
And you've been here 3 of the 4 years, correct?
3 years, but Dr. Collins and Dr. Bentley actually came to us and kind of put an idea in our ear to start a chapter at U of L, and there were 6 of us. It was Farzan Puranfar, Caroline Curtis, Brooke Fukuoka, Amy Beckerman, and Trey Parker, and myself. We started the chapter, and we've been going to, I think this will be 9 or more, all in different states, or Tennessee, and I mean, we'll travel, and it's something, like I said, we'll do even after we graduate, and it's something that's part of me, the service that you provide, and anybody can help. I mean, I know the dental community, it's a big part of RAM to actually do the dental portion, but anybody can come out. One of our students' husbands came and you know, just helped out, you know, just to provide service, and it's amazing. It's one of the most fulfilling things I've done in my life.